My name's Seth Gregory. I'm a pediatrician at Mayo Clinic Health System. Yeah, I grew up in Georgia, and at the age of 7, I had throat cancer, and that experience really kind of piqued my interest in medicine from the influence my doctors had on me and the people I met through that experience. And so I went to the University of Georgia for undergrad, and then I went to Mercer School of Medicine, where I got my medical degree. And during that time, I actually spent a year in Bolivia volunteering with some different hospitals. And then afterwards came back, and my wife and I moved to Rochester, Minnesota, where I did my residency in pediatrics at Mayo Clinic. I really enjoy pediatrics because children do not choose to be sick. It's not something of their own making, and so being able to help heal a child is very rewarding for me. So whenever I have a child that's upset or nervous about being at the doctor's, I do have a magic kit. I have a magic coloring book, the magic wand, which is actually a ear curette that lights up, but they like that. And then also I tend to wear a goofy tie, whether it's dinosaurs or rubber ducks or whatever, and kids seem to really enjoy that. Well, I think partnering with the parents is key, since when they leave the office, they're going to be the ones managing the child's care. And so it starts with first listening to the concerns the parents have. They're coming to the office for a reason, and so I do give my full attention. And oftentimes I give them written instructions, because going to the doctor can be a little distracting between trying to remember what you wanted to ask, me providing information, your child running around the exam room. And so I do try to simplify the instructions, and parents always know they can always call the office too if they have questions or concerns after the visit. So I think here in the health system, or in Mayo Clinic in Rochester, it really does put the patient first. And so if I have a complex child or we have a question that needs to be answered by a specialist, they really are just a phone call away. So when we have a newborn baby, especially for first-time parents, it can be a pretty stressful experience. And usually with my first visit, if I haven't cared for the child in the hospital and I'm meeting them for the first time, I get to know the family, they get to know me as well. And we also team with our lactation services, who work not only with breastfeeding mothers but also with formula-fed babies to ensure that they're gaining adequate weight. Parents can come in for a weight check anytime to meet with lactation. So I'm married. I met my wife in Bolivia when I was volunteering there at different hospitals, and we live in Red Wing, and she actually works over in Rochester doing breast cancer research as a graduate school. So when we do have time together, we like to travel. We like to be outdoors, hiking up different state park or hiking up the bluff nearby. We really enjoy that time together, and I also like to read. I am a bit of a bookworm. But I do like to read other areas besides medicine, so fiction, nonfiction, anything piques my interest.